Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you all that you need to know about COVID-19 on Thursday, the 4th of June. First up, a look at the numbers. In just the last 24 hours, there have been almost 10,000 new cases, 9,565 to be precise. The number of total deaths in the country stands at 6,005, and perhaps it's these rising numbers which is behind our top story. There has been a change of policy when it comes to quarantine rules in the capital. It's now been decided that anyone who travels to the capital has to undergo 7 days home quarantine. Now, initially the rules weren't there. It was only for people who were symptomatic, but now it's for everybody who travels in by flight and by train. Interstate buses haven't been started yet, but when they do, this will be applied to that as well. Authorities have said it's all part of aggressive COVID management that starts right now. The next story that we have is that we've been reporting the reverse migration that migrant workers have been doing. In fact, trains have carried back 5.4 million workers back home ever since, and who wanted to go back because of the lockdown, because of their wages stopping. Also, many have walked back. But now there are signs that people may be traveling back to their workplaces and to cities as well. One instance of that comes in from Lucknow, where the Pushpak Express, which started from the 1st of June, has started carrying back migrant workers. In fact, according to rail officials, it's carried back 1,100 rail workers since the 1st of June. It includes white-collar workers and self-employed people traveling back from Lucknow to Mumbai. Of course, it's just a fraction of the millions that have gone back home, but it's something that policymakers are hoping will happen more so that economy and workplaces can jump back. The next story that we have is a study that has been done by economists in America, which says that the lockdown has had major impact and has caused numerous invisible lives. It says that it's led to violence, indebtedness, starvation, and extreme stress in India. And they point out the fact that India didn't have enough social security measures, and people just didn't have enough savings to tide them over the sudden lockdown that had been announced. And so they point out that extensive measures, including cash transfers, need to be taken if such an extreme measure like another lockdown is brought again. So more details of that on our website, the study that has been done by 2 economists in America. Speaking of studies, there are now major doubts about a study that was published in leading medical journal Lancet. The study, after Guardian newspaper said that it was based on a database from suspect means, and the database is from a US company which they said didn't have enough medical credentials. Now, based on this Lancet study, WHO and several countries suspended and changed their policies vis-a-vis HCQ or hydroxychloroquine. In fact, WHO suspended its trial, which was taking place involving many countries. India, of course, has decided and has continued with hydroxychloroquine by giving them not just to healthcare workers, but also to frontline workers to prevent them contracting coronavirus. Now, of course, Lancet has said that they are looking into this study that was published on the 22nd of May and whether it had enough peer reviews or not. And finally, the good news is that many countries which were under severe lockdown in Europe and those that were hit by the coronavirus before India, they are now starting to open up. Countries like Italy, whose Lombardy region was one of the worst hit in the world, it has now opened itself up to tourists yet again, tourists from Europe. And Paris has also reopened its terrace cafes and its other cafes, allowing them to sprawl across the pavement in order to accommodate social distancing. So if you're feeling low now, look towards Italy and France, which were really badly hit, had high death rates as well, but are now bouncing back. Well, those are the news updates for now. Keep tracking them on hindustantimes.com.